Oh my God. Okay, Dr. Tommy Rhee, I am really excited to have you on here. And I'm going to be very frank here that this has stretched me out because I did extensive research on you I also got your audiobook so I can be more familiar about the conversation we're having today. But this is so fascinating and I'm excited to share this with our audience here on Wellness to Greatness. But before I get to all that, I want to introduce you to this gentleman here. And can I call you Tommy, or do you prefer Dr. Rhee, or what do you prefer?
Tommy's fine. It's fine. It's fine.
Tommy's fine? Okay,
Yeah.
cool. So Tommy is a practicing chiropractor, and he's been doing this for over 30 years. And in his profession, he also worked with the Buccaneers, the Tampa Bay Buccaneers, since 2015 to 2018, which is really exciting. And I want to pick your brain on that too, like what that was like. But you've also worked on other professionals, like athletes who are from the NFL, NBA, NHL, the MLB. What is MLB, by the way? What is that?
National Basketball Association.
Oh, okay. Sorry about that.
Oh, wait. Was it MLB? I'm sorry.
M as
Oh,
yeah.
oh, Major League Baseball.
Okay, Major League Baseball. Okay. I should know that. My husband is like a sports fanatic. Like there's always sports on in our house. And also the UFC players, which is so cool. I love that. I actually just worked on an MMA client the other day, and I just love picking their brain in that world with like athleticism. It's so cool. Anyways, so what I find really interesting is that you also run more than one chiropractic businesses, facilities, but you were kind of the pioneer in different modalities, such as active release techniques, which I use that all the time in my massage therapy practice. So thank you for pioneering that. So it rimpled out here into Canada. And exercise with oxygen therapy, whole body cryotherapy, piezo wave. Did I say that right? Piezo wave, shock wave. Yeah.
Piece of away, possibly, huh?
Piezo, like
There you go.
Italiano. Yeah.
There you go.
Piezo wave. And cryophos therapy, which can you tell me a little bit more about cryophos? That's like more cold therapy. Is that correct?
Yeah, cryophos. So it's basically just using a handheld device and localizing there's that whole body cryotherapy you get into either on a cold plunge or in a chamber, and then you drop your core temperature down with that kind of manner. With cryophos, it localizes that particular, just like an ice pack that you may put on your elbow for like a tennis elbow. Well, you
Yeah.
use the maybe like carbon dioxide or no, I think CO2, yes, carbon dioxide,
Yeah.
and you cool that area down with the gas.
That's really cool. Okay. Because there's this whole hype on right now with cold plunges. And when I've been learning more about women's health, and a majority of my listeners are females at this point, and I've been learning that doing cold plunges for females, there's actually you should limit how the temperature, I think it's nowhere past 15 degrees or something like that. Is that something you found also in your research and your experience?
Well, here's the thing with cryotherapy, and just what you're trying to achieve is two things. You want to go through a phase of sympathetic to parasympathetic. So, when you hear about you have like a inflammation in your body or some type of arthritic situation, some type of inflammation in your joints and it's caught, you have to get it out, right? So
Yeah.
then you're looking at the mechanism, how to get that stuff up. So if it's the venous flow or the lymphatic flow, you need to get it out in some of that interstitial extra fluid that you have between the cells. So the way this was all started was back in, I think in Japan, there was a rheumatologist that was dealing with RA, rheumatoid arthritis patients, and they wanted to figure out how to decrease the inflammatory from this autoimmune problem. So then they started looking at this the cryotherapy and using nitrous gases, and then drop that temperature down quick as possible. Now with that therapy, you're getting down to like negative 166 and negative 200 degrees. But the thing is that you're only exposed for about 2.5 minutes. What you're trying to achieve is you want to achieve as quick as possible the vasoconstriction, the sympathetic reaction. So as we go through a thing called cold plunge, the first thing our body does, we sense a cold. So we want to do vasodilate. That's why your skin's turn red, because you're opening up your capillaries. Once your body identifies you can't cool it down or warm it down, then it collapses and it does constriction, and it goes into the mode where it's protecting you, so it shunts the blood from the extremities into the core. What you're trying to do is you're trying to achieve the parasympathetic, the secondary consequences when you come out. That's where you have the automatic flushing. That's when the parasympathetic comes involved, and you have a quick dilation. That's when all your vessels come out to quickly oxygenate the blood. But in the secondary portion, you dilate the vessels of the lymphatic system and the venous flow, so then you're getting all that metabolic waste out as quick as possible. So that's what you're trying to achieve. You're trying to get the excess fluid out, and that matter of sympathetic parasympathetic method is really like strongly acuted in this type of cryo world.
Okay. So what I hear you saying is that it's for a short period of time. So even for females, they will get the benefit if it's below a certain degrees, but maybe not be in there as long as what they're saying online. Because I've witnessed and heard people say too that they will sit in it for like 5 to 10 minutes. So in that case, maybe not as cold, but if you're doing the quick one, you can even do that maybe in a shower or in a
Yeah.
cold plunge bath.
Yeah. Yeah, you're trying to get to the sympathetic where you're actually shunting the blood from the extremities and you're constricting it and it goes into your core. Once you go into sympathetic, which is that fight or flight, then you come out of it. And then the opposite, the parasympathetic, where the relaxation comes on. And that's what you want. You want to achieve that big flushing through your body. And that's why people say, I feel so relaxed, because you vasodilate all your vessels. That's what you want to achieve. So it's not so much during the process of the cold, it's afterwards. That's where the benefit comes on. And that's how this whole thing about cryo started coming up. So when you're dealing with like, inflammatory response from like, some food sensitivity or some environmental, and you feel that lagging or the heaviness, well, that may be caused by some type of excess inflammatory response in your body. So you want to think about, how do I get that out? People like to exercise. People like to do some type of movement to, vasodilate your vessels. But sometimes you need to get like a quick jolt of that kind of rush. Well, that's where the cryo roll comes in there. That constriction,
Yeah.
sympathetic, and you come out the parasympathetic, and that release and that real quick metabolic waste getting flushed out.
Okay. Yeah, I love that because I do the cold plunge maybe once a month, once every 2 months at this facility because I don't have my own bath besides my shower. I'll do that, but it doesn't get that cold. And I notice I'll get shivers like, woo, and then I just sort of relax. And that's when I know I can get out of the bath or out of the cold plunge. So that's cool because I always feel so much better after. And I feel like empowered that I was able to do it in the first place.
Absolutely.
Yeah.
And again, it's a secondary component of it, not so much the code. So
Yeah. Okay. Cool. Sorry, I just jumped into a question in your introduction. My bad, but
it's okay.
when it's
I love
there,
this.
yeah, when it's there, I just gotta ask or I'll forget.
Yeah, yeah,
Uh,
yeah.
so, but what we're gonna be talking about today is, and you actually have a book that you released on this. It's The Future of Regenerative Medicine: Unlocking the Potential of Topical Stem Cell Therapy. And that's the audiobook I was getting through. And we were planning to actually meet probably later on, like 3 to 4 weeks. And then I had an opening today. So I only got to chapter 7, but it was, wow, like a lot of great information. I have to do a little extra research to make sure I fully understood. And I was just like, this is really neat. And that Jeff character in your book really painted an interesting way because you wrote about his perspective. Okay, here's the information, which is very detail oriented. So for someone who's not in the medical field, could seem complex, but then it is explained in a simple matter so you can understand the concept. And I really appreciate that in your book. So you are an inventor of a few new patent items, or a couple, sorry. The one of them being a patent pending brace to help design improve injury recovery and support. But what we're going to dive into today is you're the founder of Regen. And it's also patent pending, or is it patent now?
No, it's patent pending. It takes a little
Patent,
time, but we're in that process.
yeah. And it's cell-free stem cell cream, and it's designed for transdermal regenerative therapy. So, in other words, it's addressing the root causes of aches and pains and supporting comprehensive natural wellness. And I wrote a little bit more notes because I was like, yeah, I need more information on this. So it's a cutting edge approach because in your book you actually explain this is that it's using our body's natural recovery process by leveraging with bioactive molecules from the Wharton's jelly MSC. And Wharton jelly comes from the umbilical cord.
Yes.
So a lot of my listeners are moms. So you know what I'm talking about after we gave birth to those babies, that weird cord coming out of us that's like blue and red and white. You're like, what is this thing? It's the in between that. It's like the cartilage, right? It's the so there's no specific DNA attached to the Wharton's jelly. So that way it could be used for anyone. There's no adverse effects necessarily where it has to match that person's DNA in order to use it, correct?
Well, yeah. So there are DNA. It's they call it the mesenchymal stem cells. So there's DNA in there, but what we're achieving is what they secrete, that those bioactive biomarker, those signaling. So every cell has like a receptor to do something, right? So every cell has a responsibility, but you have to signal that cell to do something. So you're looking for these little signals from either microRNA, some cytokines, some microprotein, some signals that tells that cell to secrete this or replicate this or divide this. So these cells are sitting, these adult stem cells are sitting there waiting for signals. And as we age, we slow that process down. So then you take that signals, but you get it from the very immature tissue like the umbilical cord, and you get that, and that's what's in Regen, the thing I developed. And then you put it into your body. Now you have a large signal device. Now it's telling your cells to do that, what you're meant to do, either replicating, anti-inflammatory, something. It's going to tell its proper use for that cell. So that's what you're trying to achieve. You're not looking for so much the mesenchymal stem cell, but the things that secrete. They call it like EVs, extracellular vesicles.
Yeah.
And that's what has the signals that you have to tell you, like things like, your cells of like tenocytes that make tendons, chondrocytes that make more like cartilage, and then satellite cells, they make more muscle cells. You tell those adult stem cells, hey, turn on, regenerate, multiply. And that's what you're trying to do. You're trying to get that age cell to kind of wake up and do your job.
Yeah, no, that's really interesting because you also explain in your book that there was a lot of testing for stem cell injections. And you talked about the contraindications of that because it also has a potential of has growth hormones too, as well in it. So if you were to inject it into an area, it could potentially grow a tumor of some such, right? And, or it can really lead to, it could be a injection infection. It could have, what was the other things too? If you want to refresh my memory.
Yeah. So the big thing with when you take a cell like a mesenchymal stem cell, right? So it has its DNA, right?
Yeah.
So it has its code to do something. You don't know what. So this is how stem cells, the theory. So it's still the wild, wild west, and people sort of understand. They sort of don't understand. So there's two theories of stem cell therapy. One is you take this thing called the mesenchymal stem cell. There's all kinds of different stem cells, but we're trying to use mesenchymal stem cells. And then it has a potential to differentiate into a target tissue like the cartilage, ligament, muscles, and stuff like that, right? But then you go into the biology and say, how does that particular donor site, the umbilical cord, know the same DNA chromosome that you have a target? That's impossible. If you look, remember DNA in biology, how it has that ATCG and it has this code, and it with that code will dictate what's going to turn into like either a muscle, hair, or something, right? So because of that, it's impossible to replicate your DNA from the donor's DNA. So then you think about, all right, you don't want to use that DNA. You want to use the signals that come from that cell to turn on your existing tissue to actually do the job. And that's what that's all about. So when you hear like, I'm shooting 10 million live cells in my body, well, that's where the danger occurs. Now you're taking something that has its DNA component and you don't know what's going to I wouldn't say mutate, but it's going to go ahead and differentiate into its proper coding. Because if you take something like so there's remember mesenchymal stem cell, but there's also embryonic stem cell. So you can take an embryo, which is aborted babies. We don't get involved. We don't, that's unethical on our side. But the thing with that is that you don't know what you're getting. You might get that embryonic tissue of a cardiac tissue and you want to take care of your tendon. Well, you don't know what's going to go. It doesn't know what's going to evolve into. So you want to make sure that you're looking at the signal, because the signal is going to just tell your existing tissue to do its job to duplicate into its proper, formation, instead of having that tissue that you don't know where it's coming from and make it go into a tendon and you don't know what's going to form into. So that's what the tumor formation when it comes to live cell is higher risk than what they call the EVs, the cell-free type of signals.
Right. So, okay. So yeah, because I remember you talking about the EV and how that is different. It's not has to do specifically with the DNA part, but it is a molecule to activate the regeneration part of the cell, correct?
Yeah.
Okay.
So every cell in our body has a signal. We're waiting for a signal. And then it always, from cytokines to like interleukins, and then all the way to transforming growth factors. There's all kinds of things our cells are weighing. And once we get the information, it does its job. It's meant to do one thing. So, you know, so if you look at, remember how they had like in a hormone, and we call it the endocrine system, where we have
Mm-hmm.
like a hormone gets secreted and it goes to a target tissue like your liver and it does something, right? So in our world, we call it a paracrine effect because it's cell-to-cell communication. It's not a long communication of the endocrine system, but it's more cell-to-cell communication. So when you have this cell-free, which is basically encapsulated information that goes next to the target tissue, it communicates. That's what we're looking at, is the paracrine effect.
Perfect. Yeah. Okay. Thank you for painting a picture of that, because I remember my first pregnancy with my son. They were talking about where I could freeze the umbilical cord. So in the case that my child is sick later down the road, it has his DNA. So that's why I was like, how would you use that for anyone else? But now you broke it down where there's actually molecules in there that can that you can use that is unrelated to the DNA factor that we could, yeah. But there is a contraindications of doing the injection. So that's why it's really interesting that you've come out with the cell-free stem cell cream. And I do have questions on that.
Okay. No, we're here for them.
Yes, but before we dive into that, I always like to give people a bit of background of who we're talking to. So, do you mind if we dive a little bit in the personal stuff?
Go ahead. Go ahead.
Okay, perfect. Because like I'd like to understand your motive of why you're so active in helping people to the next level. Because in my research, I saw that you have a family background of a generations of doctors in the family. And so I'm wondering if that's part of it, but you also have kids of your own, and you're also a vet, right? Veteran, sorry,
Yeah.
veteran. I should identify that. And I have so much respect for veterans. I have massage clients who are veterans, and they tell me their story. So thank you for everything you do. I know you're in the US, but it doesn't matter. You're fighting for, the rights, right? And peace. So tell me, okay, so is it true that you served as an S3 jet aviator? That's my
Yeah,
first question.
so I was a naval aviator in the backseat of a jet called the S3 Vikings. And then, that was probably the best time of my life. If I look back, it was the only way I can explain it is like ride a roller coaster and try to read a book for 45 minutes. And that's what it's like. It's like your hands are just basically just your life is in someone else's hands. But more importantly, it's the excitement. It's the excitement of the adrenaline and the rush, and then also being focused into your job at the same time. So I was responsible for things like, radar, ESM, acoustics. And then, during our main mission, which is hunting submarines, we drop these sonar buoys, and then we have to stay in this particular area of the ocean, and we're trying to track the submarine. So during that time, you're yanking and banking, pulling 3Gs, and all the time you have to stay in total concentration to track what you're trying to follow, which is a submarine. And you have the responsibility of that. And then below you is another aircraft, above you. So in this probably in 3 square mile, you'll have these stacks of airplanes just yelling at each other, trying to communicate. And then you're the junior guy there saying, I think I know what I'm doing. You better know what you're doing. So
Yeah.
it was a lot of fun. So I enjoyed my time as far as that flying in the Navy.
So how long did you do that? How long were you in the Navy for?
I was in the Navy for 3 years. I was 87 and 90.
Okay. Well, 87, 90. So how old were you then?
I was 19. I got in the Navy at 19, got out at 21, 22, around there.
Wow. So what made you move out of it? Was there just a life direction change? Like what's
Well, I guess it starts why I went in there. I went in the Navy because I was I was the typical kid that got into trouble, rebellious, thought he knew too much, too much that I'm an alpha guy. I don't need anything. And all of a sudden I was forced into the military by some means. And then luckily I was smart enough to have these high test scores that I could pick any job. And they said, well, what would you want to do? Because I don't care. I don't really, just let me have a fun job. And they said, here, do this. And then they point me to air crew, and then went through that process of a year and a half of training. And then once I got to the fleet and I did my job, that's where the fun started. I mean, it was all fun. I mean, it was the best thing for me at the time because it taught me discipline, focus, and how to really like hone into what I really want to do and achieve it. That's the one thing good about the military. It helps you like set like stepping stones to get to what you want to do. Instead of dreaming and just saying, I'm gonna do that one day, it tells you just do it. Just go do it.
Yeah, I respect that so much. I'm tempted to just throw my kids in there.
Oh, 100%. It's the best thing in the world.
I know. But then there's also that fear as a parent, like, what if they get called out to war? You know what I mean? But I'm like, I want them to learn those life skills. That's so important. Unless I just turn into a drill sergeant and start doing that at home, you know?
That helps out.
Yeah, that does. So what's the background, your family background as physicians?
Okay, so my dad, he was a surgeon, and I was born in Malaysia. So they take these doctors. So my parents are born in Tokyo, and so that was before World War II. So it's funny about my parents. So they got caught in two wars. Just going back in my history, I started thinking about this recently. So my dad and mom got caught in two wars: World War II when they bombed Japan, and then they went and lived in Korea. Then they got caught in the Korean War. So they got like
Jeez.
double dipped everywhere. So anyways, they got married, and then they moved, and then my dad was a physician, a surgeon in Korea, and then he went, and then and I guess Malaysia got their independence, and they hired my dad to run a clinic in the jungles of the Malaysia. So that's where I was born, Malaysia. And then, he was a surgeon. I think his uncles, brothers, there's families of the surgeons and in that medical world. So, in the Asian community, being a doctor is a pretty prestigious thing. Every
Yeah.
parent wants their kid. So that was that. It was set in stone for me. Goes, that's what you're gonna do. But since I was a little wild kid, I kind of rebelled. But deep down, I always saw what my dad was doing to helping people and going out of his way to helping. So it's kind of instilled in me to be that person. But I was a sports guy, so I remember talking to my friends like, I want to be a sports doctor. I want to do. So then, you know, through life's little lessons, I go in the military, and then, then having like that sense of like, okay, now it's time for me to grow up. And then when I got out, that's where I started going to that, the stepping stones into the collegiate world, then into chiropractic school. And I want to be a non-invasive doctor. I really looked at like being more of a preventative doctor, not so much as the aftermath. I wanted
Yeah.
to do that side. So that's how chiropractic got involved. And I just looked for the best chiropractor out there in the sports world, found him, followed what he did, and then led me to the path of like from UCLA days to, Olympic level athletes, world championship, and then of course the Tampa Bay Buccaneers, then WWE. Then you're just going everywhere where there's these athletes that are like, looking out for your type of like services.
Yeah, absolutely. And what I love about chiropractors too is that it's not all just snap, crackle, pop, but this is what differentiates a good chiropractor to no offense to the other ones, but meh chiropractors that they just focus on this one type of modality when there's so many other things out there. And then it shows like all the things that you brought into your practice, and then you're still seeking on how to help people outside of the snap crackle pop because there's so much you could do muscular related. And I have found incredible chiropractors across Canada because I lived in different provinces. So, and they've really helped me on my journey. So, thank you for your service and your ambition to help others in different ways.
I think anybody that's into, understanding how we're evolving as, in the health industry, right? You have to keep evolving, right? So if you got the basic principle of the physiology and understanding about cells and what it's trying to do, you're trying to regenerate, heal, correct, and you understand that principle, then you say, all right, let's use this modality, let's use that modality. Then you look at anything that can help you along, and as time goes on, you start seeing more advanced stuff. Goes, okay, that does even a better job than the previous stuff. So, if you're not up to times and up to like, the newest technology, you're kind of slipping past and giving injustice to your patients. You want the best outcome for your patient, but then you also need the best equipment to help you with that outcome. So that's why I look at just the basic understanding of the anatomy, just what it does, and then I look at the equipment that can assist me to that. So if you go to the chiropractor, there's nothing wrong with like aligning you up and freeing up nerve innervation because you have subluxation. There's nothing wrong with that. But in the sports world, we look at the tissue around that joint. We look at the, the ancillary joints. We look at like things that are connective, like those the kinetic chain. You may have knee pain now, but maybe it started with a hip pain or an ankle pain. You look at the other joints and see the foundation of all that injury, and you kind of work backwards until you find that foundational injury that they had years ago, and you correct that. So it's like if you like mysteries, this is the greatest profession. You're having this is a fun time.
Yeah, absolutely. I was gonna say, like, even massage therapy, there's a certain point where I'm like, okay, I feel like this is chiropractor related, or this is physio related, or or is it more nutrition or more stress related? And I remember one time a physiotherapist told me, Janelle, you're not qualified to and I wasn't diagnosing people, but I said, but this is out of the norm. I know what norm's supposed to feel like, and I could feel the vertebrae when they're out of place. I could feel the sacrum and the iliac joint. I can tell those things. Not my job to fix it, but there is professionals out there. So that's where I send them off to. And I don't know if it's the same in the United States, but in Canada, majority of provinces, except for Quebec, which is where I'm living right now, is you have to have a minimum 2-year diploma to be an advanced remedial massage therapist, but you still have to study outside of your, every 2 years you have to submit so many hours, and so I think it's important that us, in this industry, that we need to collaborate and work together, because we all help each other. All our modalities together combined can really help our clients.
Yeah.
So
What's great about you is that people say that the diagnosing is the most important side of any type of healthcare, right? If you don't know what your problem is, then how are you going to fix it, right?
yeah.
So one of the special tools that I enjoy and you enjoy is palpation. You've got
Mm.
to. That's more. I think that's even stronger than MRIs, X-rays, because X-rays, I mean, for fractures and stuff like that, misalignments, I get that part. But when you really feel normal tissue and then you come across someone with abnormal, it sticks up. Like, hey, this is a red flag. Why is it different? And then that's how the starting point goes. So then you say, all right, this is abnormal. Let's start going and maybe like kind of like backing that up with an X-ray, MRI. Then you start combining everything together. If you just stand alone, just do one modality or one type of diagnostic tool and say, okay, I'm going to stick with that, you're kind of gambling. You need to back it up with palpation, maybe an MRI, an orthopedic test, and range of motion, and then some history, and then it all puts together. But you have to have everything. So when it comes to massage therapists, when they say something, especially when that physio said, hey, it's out of your realm, look, I don't say that. I said, good, what did you find out? Because you need all the information. You can't close that door just because the license said you can't say that. You have years experience. So I said, what did you see? What did you feel? That's what I want to know. And then I back it up with, oh, I concur. I feel the same thing. So now we're on the same pathway of helping this patient out instead of this ego trip,
Yes.
That's what this journey is all about. I try to explain to people, why did you develop Regen? Why did you get the book? I said, it's more so for the patient. You want the control back to the patient. If you're not happy with your doctor, you think that you just listen to him, you'll be fine. Go shop him. Go do a second opinion. Go out there and find out what's really the issue here, So that's why you have these podcasts to get more information to you guys. Then you have like Google, AI. You have all these tools that are going to help you out. That's very strong out there. And I always tell you, if you don't believe me, just Google it. We do that right in front of the office. Here, look what this is your symptoms. This is your x-rays. And so then I explain to them in any aspect so they can understand, so we're on the same page.
Exactly. Exactly. Well said. Yeah, that's great. Um, and yeah, like, that saying, it takes a village to raise a child, but as we get older, we also still need a village to take care of ourselves. We need other people, a team. So if one person says, no, I'm just going to do massage therapy and you're going to take care of this issue, Janelle, I'm going to be like, I'm not going to guarantee that, because there's a lot of modalities that I'm not trained in. Like, I could do some joint mobility, but I cannot do an adjustment. Or I have some educated background in yoga therapy, but I give you stretches and this and that. But you got to find people within their realm. So that's where you have a team of people who become your community that help you on your journey, right?
Oh, 100%.
Yeah.
So here's the cool thing about what you're saying about like a team. So I like our mission statement in my office is to treat everyone like a professional athlete. So
Mhm.
Professional athletes, they have a team. They have the medical side, they have massage therapists, they have a physio, they have a strength coach, they have nutrition, they have their team. And that's why when I see patients here, I say, you need a team. You don't have to be that extensive, but you just have to have like an app that can help you out. You need massage, you need a team, and you stick with that group, and then that group will start knowing your anatomy, and then they know the normal and abnormal. So when they feel something abnormal, they say, all right, let's work on that. So just like what you said about a team, everybody should treat themselves like a professional athlete and get your team together and just stay with them.
Yes. And you know what I say to my clients? I have some clients that are like, I've never been good at sports. I never, they want to start getting healthy and, work out or whatever. And I said, just be an athlete of something you like to do. And they're like, but I'm not an athlete. I'm like, go for a walk. You are an athlete of walking, go climb the stairs. You're an athlete of climbing the stairs. Like, for us to categorize and think we have to be super excessive in a sport and that being their career, of course, it doesn't have to be that way. So, and if I have someone who's fit but doesn't do sports, but I'm like, what do you do for a living? They're like, well, I'm a painter or I'm a contractor. I'm like, you're an athlete in building things, so you got to take care of your body just like an athlete does from intense training, right? So
Absolutely.
yeah, I love that. I love that we're on the same wavelength here. So let's get back to this the cream that you created. My God, my brain's going brain fart. Uh, the Regen cream. Okay, thank you. So I was curious. I started reading some articles about it, and I didn't get too far in before a call, but I wanted to know, do you have any controlled clinical trials yet on this product?
So because I'm this developer, self-funded, there's so much things I can do. So as far as like a clinical trial, very expensive. That has to do with like an IRB, like an institute that regulates how this testing with patients. So no, I don't have that specific stuff, but I do have a pod study that took 80 patients, and it was just a basically the question before they did Regen, and it was I try to vet them for like low back or osteoarthritis in their low back. And I basically asked the questions, what is your pain at this time? And then they did Regen for 30 days straight. And then I asked the same questions afterwards. And with that, we had a 51% reduction in pain. So
Wow.
on that study, it was pretty interesting. But again, it's not in that clinical trial setting with the IRB. So then we also have like case studies that Dr. Woods did a pre and a post X-ray of a cervical. They call it a spondylolisthesis when you have a displacement of a segment, indicating there's some type of ligament laxity or tear from a whiplash. So
I know spinalithesis.
yeah,
Yeah.
spondylolisthesis, yeah.
Yeah, it's like the dog collar one. So guys, imagine, like, I'm just gonna show on my hands, but like if your vertebrae are like this, and then the ligaments, it like slides off like this, right?
Yep,
So
that's it.
for those who are listening, it's almost like you imagine your vertebrae are on top of each other. So I'm doing my fists on top of each other, and it's sliding front or back because it has no support. Those ligaments aren't there to stop it from sliding forward or back.
Excellent, excellent. That's great. That's perfect.
Okay.
So there's different grades, meaning that the longer displacement, the more of a grade it is. So this grade was about a grade 2, 3. So that was before X-ray. So after doing Regen and a shockwave device to help drive Regen further, then we did a post X-ray, and then you see the segment getting closer together. Now it's a grade 1, so there's a big improvement there. So that indicates with that period of time, you have the ligament starting getting into its not so much laxity, but more as a strict rigid self, and it's getting stability back in that segment. And then the most important thing is that this guy was able to get back out of that extreme pain and be more physical with his movement with his neck.
Wow, that is incredible. Okay. So I'm sensing that the audience is like, "Hey, that's great, but like what is this good for? Like who would this best suit for? Is it just people osteoarthritis or just people with um, ligament tears or swelling or like ACL, PCL in the knee? Like who would be the best candidate for something like this?"
Wow. So, I mean, it's a broad spectrum of people. So let's start off with a generic group of people that's a 45 plus. So think about that you are in your 20s, and when you exercise and you push yourself to max, you have 1 day recovery and you're back to going 100%. Real fast recovery time. as we age at 40 plus, it takes longer to recover. Now, when we have those, type of situation where we're trying to work out every day and you're not giving yourself a chance to rest, well, you don't have the ability to recover quick. So that particular like repetitive injury, like let's say you have like a knee pain, like a jumper's knee, you start getting that tendonitis on that little infrapatellar tendon. Well, you start getting that ache because you don't have the ability to regenerate quick like you were 20. Well, that's that particular incident where you can do regen. Or when you have like joint space loss because the cartilage is being destroyed because you're jumping too much either in your hips or your lumbar or your knees. So you're losing that cartilage. So your joint space starts decreasing down. Well, you have to regenerate that cartilage to get that joint space back to its normal length. Then again, regens that person, cream.
Hmm.
So you just think about everything that has to do with like regenerating tissue that doesn't have the ability to heal itself quickly. So then when you look at athletes that have to perform at high performance, when they're younger, they should be able to recover. But the problem is their trauma is pretty extensive. Well, you still got to speed them up. So again, you use regen to speed that process up. So it's basically anybody that has to do with movement and it's restricting your movement because of this pain or degrading tissue, you have to quickly regenerate that tissue.
Okay, perfect. So it could be like tendonitis. It could be, like rolling your ankle or, I'm just trying to think of like the general public, people working a desk. You know?
Oh, even
Yeah.
here's the thing with desk. Desk, the biggest thing you hear about desk, not only low back pain because of posture, but it's the old tennis cell because of using the mouse. When they have
Mhm.
to use the mouse, they'll start, lifting their finger up. Well, that's attached to the lateral epicondyl on the elbow, that little bump on the outside part of your elbow. They start
Mhm.
feeling that ache and pain there. Well,
Yeah.
that's because it's the overuse of that muscle, that extensor of those two fingers. So now what you were thinking about is, well, let's shut it down. Well, in order for you to shut that down to heal faster, you got to turn off the wrist, the fingers, the elbow, and you have to immobilize that. Well, nobody wants to be immobilized for that period of time. So again, regen is that to speed that up. Do you want to apply that on there so it quickly makes that tissue heal?
Yeah, that's right. And I find too they those braces that they wear where it kind of compresses it. So every time you move the finger, it's almost like an active release. That's helpful. But if there's a lot of inflammation to the area and you're doing that all day, is that beneficial? I don't know. That's why I'm wondering if the cream would be an additional add-on to help with the inflammation.
No, absolutely. Remember, there's a signaler in there called interleukin 10 that helps prevent inflammation in there. So that's a big one that we look at. So when you use regen, your pain gets reduced real fast, and then you think, oh, my tissue is healing. Well, it's not so much the tissue is healing; you decrease the inflammatory world. So
Okay.
if you think about like when you sprain an ankle, and then the next day the pain's worse. It the injury didn't get worse. It's just more fluid got into that joint. That's what you're feeling. The pain increased. So once you get the inflammation on there, then it'll allow you to do normal movement without compromising that ligament that maybe got torn. So inflammation is probably the biggest thing you want to decrease your pain.
Right. Yeah, because that's the inflammation that is setting off those bells and whistles that something's going on, right?
Yeah,
Yeah.
absolutely. Yeah.
Okay. Now, so I was trying to visualize this because there's some areas where, let's say I were to massage the back of my neck, it's more, you know, to put this cream to help with an injury there. I feel like it's a bit easier for it to access that point. But if I'm thinking of like a knee joint, for example, and let's say I've injured an ACL or PCL ligament, which is deeper in there, like how do I know the molecules of this cream is getting deep enough to know what cells need to be activated for the regeneration of that tissue?
Okay, so good question. When the tissue goes into injury mode, it sends out signals like I'm injured, right? So it's
Mhm.
either going to send out some type of like, the mast cell histamine, the inflammatory process, or something that's going to signal, right? So as these molecules, these signals from Wharton's jelly comes in the area, so we have a transdermal agent that goes to the three-layer of skin to go to the deep tissue, and that agent is called DMSO. So DMSO is a vehicle that takes these bioactive biomolecules and pulls to the skin, and it gets into the tissue. Once it gets in there, there's a signal your existing tissue says I'm injured. It's called, and then
Mm,
you have these bioactive biomolecules. They listen to that signal. It's called honing. So it hones into it and it migrates to that area where it needs to have that signal where it goes cell to cell and the paracrine effect works. So that's how that whole mechanism goes. So just like if you're injured, you send out signals, so your existing tissue will go down to that area to help it recover. The problem is, as we age, we don't have that large abundance like we used to have when we were younger. So we use Wharton's jellies, that information to go down there and signal with the vibrant tissue.
That's amazing. So that honing, that signal essentially is around that whole area, that joint. So regardless of how deep the 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 injury is, it's able to access that signal. Then it can send that synapse, that message out of what needs more to heal, whether it's
Yeah.
bone, whether it's tissue related. What about nerves? Like I have a lot of clients who have damaged the myelin sheath, like from over chronic impingement, and or they have a certain chronic disease or something like that that's affecting the myelin sheath or the nerves. And just so my listeners know, myelin sheath is like a protective layer around your nerve bundles, and then when it starts to wear down, it can be very sensitive. It's like touching an electric line, like electricity. It's like the outer protective layer is like gone and zap. And depending on how thick it is, it's more protected, and thinner, it's more sensitive to being
Yeah.
zapped. Yeah.
So when it comes to nerves, there's a lot of research coming up right now to really kind of like work on that myelinated sheet, right? So the cell you're targeting is called the Schwann cells. I hope I'm saying it right. Schwann cells. So you're trying to target that to create a better environment for these myelinated sheet to kind of like, to heal itself and develop back into its normal sheet. So there are studies right now that are looking into that, and it's promising. The problem is that I'm a connected tissue guy, so nerve is not my thing. There's some research behind it, but the problem is that when you sever a nerve, the difficulty is that, people think I can just regenerate the connective tissue. That's a long time away from now.
Mm.
I think what you're talking about is that maybe you have like a trauma of a nerve from like a dural sleeve, or the myelin sheath that gets irritated. Just like when you go to a dentist, you get a root canal, it may take 2 to 3 months to recover from that nerve irritation. Well, it's the same thing. If you get a nerve irritation like your piriformis or the ulnar nerve, your symptoms will still be there, but it's healing. It's going to take time. You just have to
Right.
understand that you got to give it the proper information, the signals, give it the right environment, and keep doing your exercises and learn your biomechanics. And don't go to how you typically get injured and you try to change your biomechanics to avoid that type of injury. You have to continue to keep normal range, because once you recover, you'll have that same type of biomechanics that should be normal, instead of the actual, like the one that you're trying to, like, avoid the pain and then change your biomechanics where you maybe affecting other joints. So a big thing is that just keep on doing your exercises and seeing therapists to keep you moving forward with that.
Yeah, absolutely. And I remember hearing, I think it was on a podcast, but it was talking about that the majority of us are walking around with herniated discs already, but we're not aware of it because it's not compressing on the nerve bundle. So it's like we only become aware of it until it's, compressing on a nerve, and then we start to feel more pain and discomfort. And so what I hear you saying is just it's not just about waiting until things get bad, but also the maintenance part. Like start building up your team, whether that is starting off with massage, and then if things get worse, like, if you start having other issues, they refer you out to another practitioner. Build your community of health practitioners. But
Absolutely.
but I guess like what I was, yes, there's some severe injuries to nerves, but I get the one I'm more questioning about is what I get often in my massage practice is sorry, I'm thinking in French right now. Is engourdissement, like carpal tunnel,
Okay.
or where it could be coming from the neck, or it could be coming from the clavicle, or the pec
Yes.
minor. So, and then yes, that is all about posture. That is all about how we hold our head. But if you're doing all those things, and then now it's like it's coming from here, but your job requires you to use your hands every day, and you're doing the things. Like, would this be something that would benefit, yeah, with yes, the inflammation, but maybe the myelin sheath as well on the nerves?
Yeah. So Perfect example, the carpal tunnel. So there's entrapment zones that you talked about, the scaling muscles, pec minor, axillary area. It can even be in the pronator muscle down in your forearm, all the way down
Mm,
to the retinaculum where it creates that tunnel, right?
yeah.
So if it's at the tunnel and you do this thing called tunnel, when you tap on it and it gives you zingers down to these three
Mm,
fingers, yeah. So
yeah.
you know exactly that you're working on the median nerve caught by the actual carpal tunnel. So then you think about what's creating the collapse. Is it because your wrist is really tight and the retinaculum is squeezing down in the tunnel that's playing havoc on the nerve? Or is it because, like you said, inflammation is occupying into that space and it's kind of squeezing the nerve? Or could it be just tight muscles that are like not allowing the nerve to floss through? So those are things. So if it's like inflammatory, regen works. If it's damaged tissue and you make excess tissue, you know how basically when you heal, you make like these type of like these scar tissue or what they call it keloids, excess tissue that you may get. It may
Yeah.
occupy into that little space. So now you have to think like, how do I break this stuff up? So the thing is that if you're in a chronic state that is giving you like that excess scar tissue, it's a two-step process. You've got to first break up the scar tissue. You've got to do a lot of aggressive stuff, either like, a high percussive device that goes right on that retinaculum where it's collapsing on the nerve, or you got to do aggressive massage, cross-fiction massage in that area. But then after that, once you kind of start breaking it up, you've got to do exercise and make the tissue, like lay down like along parallel with the right fibers. You don't want to do what they call cross fibering or woven fiber. You don't want to lay it down like checker pattern. You want to lay it down like just like a car, like on a car road. You don't want to go perpendicular to the road, right? So regen helps when it comes to the recovery component of it. When you start breaking up tissue and you lay it down right, you want to lay it down quickly. That's where regen may work better with when it comes to like a chronic scar tissue material.
Right. Yes. And in my experience, because I do have some carpal tunnel, uh, along with all my clients, but I find that what's been really effective is dry needling too. Are you familiar with dry needling, IMS?
Yeah.
Is that
Yeah.
something that you provide, or what's your thoughts on that?
Okay, so there's two types of dry needling, right? There's the one for acupuncture that doesn't go too deep, right? And then you go into that world where now you're going into like trigger point, like that little area that's not that doesn't want to let go, and they'll go deep in that area. When you're working with like maybe a trigger point that's not injury related, maybe you have a too much acetylcholine or some type of neurotransmitter that's telling your muscles to spaz out and hold still. When I hear about those things, I tell the patient exercise, do in a conscious mode, try to activate that muscle and fatigue it down so it lets go. You want to let it go on its own. But if you do deep kneeling in an injured area, remember now, you have a primary injury. Let's say you have a grade 2 sprain of a ligament. Let's say it's an anterior talus ligament on your ankle. And then you want to deep needle that. Well, you have an injury, and then now you're putting a needle in it. And now you're making a secondary injury. So you're making two sites of injury.
Yeah.
So the way I look at that is that sometimes, I mean, I understand what they're trying to do, but I think sometimes when they work on the actual trigger point where it has no injury per se, and then you go to an injury spot, you want to use that same theory into this type of injury. You got to be careful because now you're just taking one modality and say it works for everything. You got to understand what
Right.
it's used for. So when I hear deep kneeling, I think about in my world, if I were to do that, it's for trigger points that the muscle doesn't want to let go.
Mhm.
Now I start with if I feel, how you get the levator scapula, that trigger point back
Mhm.
there that females have it because your anatomy is a little heavier in the front, so you roll forward. You got to pull backwards because you're doing that antagonizing of stretching it, turning on what they call the Golgi tendon and the muscle spindles.
Mhm.
You got it. So when I hear females getting pain back there, I said you have to exercise. You have to just waste it away. And then when they exercise and do like things like like simple shrugs, maybe some upright rows, just to engage that muscle, they said, "Oh, it feels better now because you wasted all that stored energy with that purposeful type of exercise." So
Yeah.
if that doesn't work, then maybe deep kneeling because it doesn't want to let go. So that might be a challenging one. But anyways, when I hear deep kneeling, I always want to make sure that we're talking about for the right type of injury or problem that you have.
100%. And when my clients come to see me, I say 95%, and maybe it's 99, I don't know, but it's a high number. when people come to me with a pain in the area, it's most likely the victim and not the culprit. So I like to look at them fully. Like, what are you doing on a everyday basis? Was there a direct trauma to the area? Because maybe it is the problem that was direct. But if it's not direct, like a direct trauma, then we have to start looking at all these other factors. So if someone's coming with pain behind their shoulder blades, I'm not telling them to get IMS on their shoulder blades. I'm telling them, like, I can't open up your pec major, man. You're too tight there. And I've done everything possible. Now your pec minor's not letting go. And I've seen you 3 times in 3 weeks. IMS. And I make sure I send to someone who also understands it like you do, where it's not because like those knots, like for me, knots and trigger points are two different things. Trigger points, they have a referral point, and typically for me, they release within 15 seconds. And an adhesion, a knot, is something that takes about 30 seconds. And I might have to actually break it up. And I describe it as like a dam, like a beaver dam. And there's just so much debris and I'm gonna swear, sorry, shit that's built up in that area. And there's no blood flow. I'm like, you need to exercise that area. You got to pump some blood there so it moves. So I totally agree with you. So I help break it up so it gets more blood flow and more oxygenated blood in the area. But they have to exercise, like you're saying. Squeeze your shoulder blades back. I tell my clients, squeeze the lemon. Pretend there's a lemon there. Make some lemonade. Squeeze it. Yeah, I love that.
What's funny about females, when I see females and they have the rounded shoulder and they have a weak posterior chain, one of the poor exercises that they have a hard time performing is that exercise. They're rhomboids in the activation of taking the scapula and, drawing it back, retract it back. Very difficult. It's the most interesting thing is like one of the things that they depend on is not the muscle, but the spine itself. And that's why as they get older, they start getting that Dowers hump or that
Yeah.
engaged, that thoracic, because they don't have that muscle to turn that thoracic back into its upright position. So that's the biggest thing that I teach these females that come in here and with that rounded shoulder or that chronic shoulder pain. Take that posterior and learn to develop how to squeeze that scapula and have it mobile. Because if you look at some of the patients that have that chronic issue, they have poor articulation with that scapula going, adducting and abducting, right, back and forth.
Yeah.
You'll see that, like, it's just, they don't turn it on. They have to learn how to turn it on. They depend on their spine to keep them upright instead of having the muscle structure them to keep it upright.
Yeah, absolutely. Oh, you're so good. I love this
Oh,
conversation. This is so fun.
thank you very much. Hey, I'll be honest with you. I'm guessing 90% of the time too. Not sure.
Yeah, that's right. I'm like 99%. Okay, well, what is it? Most stats are like BS or something. Like,
No.
so good, whatever. Okay, so moving on to the cream, I want to talk about contraindications. So we talked about it's great for osteoarthritis, inflammation. Now, does it have the same effect for someone who has an autoimmune disease, which is related to inflammation, like RA, rheumatoid arthritis? Does it have the same effect, or is that something different?
Now, again, I'm not an expert. I'm more of a sports guy.
Right.
And but I do know the thing with autoimmune is like, basically your body's trying to attack itself, right? So it's doing stuff. So you hear things like you're trying to just like maintain the symptoms. You want to calm down some of the side effects. It's very I'm not really like an expert when it comes to autoimmune and regenerative medicine. There's some research out there that are trying to develop like stronger like T cells and other type of like bodies that help out fight off the excess of cells that attack your own body. So I believe there's some research out there with that. But as far as regen as a contraindicator, we don't look at things like cancer cells or pregnancies or open wound for regen. For our primary use for regen is connective tissue of the tendon, ligament, muscles, cartilage, bone, and sometimes maybe nerves. But when you call it autoimmune, I'm not an expert with that. But there's some research out there that's talking about these stem cells and the EVs to help out the actual like the maintain the actual like the autoimmune cells to control it so it doesn't go in excess mode to attack your own joints or body parts. So yeah.
Right. So, yeah, there might be the benefits of at least the inflammation, not necessarily that we don't know at this point for the regenerative um, factor, to help bring in the cells that it needs to heal. Like, as far as that, you're saying we don't know yet.
Don't know
But
yet.
yeah,
I mean,
that could,
that's what's interesting about this industry. I mean, every week is evolving. You hear about new research going out there talking about, all the way from like, cosmetically speaking, that has promising. But now you're looking at like kidneys and hearts and these tissues that are very important to us, and you're starting to see good research outcomes out of these things. So you're seeing changes. So eventually it's going to evolve to that world of autoimmune world, like RA, maybe like scleroderma or something interesting that is like, hey, this is kind of neat. And then I think a big research came up with eczema. I think eczema was one of the latest study they had with stem cells. So I need to refresh my reading with that, but I believe that it was very promising with that eczema and stem cell.
I'll have to look at that because that's one of my issues is eczema, and I'm working on it. It's getting better. I think it's nutrition based, but it is inflammatory. It is an autoimmune, right? So that's interesting. You have to send me that article.
I tell you, there's a lot of things that, I mean, inflammation is probably the biggest thing that we're all dealing with. If it's
Mm,
from the environment, food, especially, you think about like people talk about having an allergy for peanuts, but that's a real easy fix. I get the minute you eat it, you have a response and you start having these anaphylactic shocks and all that stuff, right? But when you look at chronic, like food sensitivity, that's the delayed results. You eat something, weeks later, you start feeling heavy, and you try to think, where am I getting this? Was it from last night's food? It could be a months away of food. You
wow.
don't know, and that's why it's interesting that inflammation is always the almost a symptom, but that's not the cause. There's something else that's creating this world, and that's the mystery. You have to go back, and that's why they do that, like that food log. They want to see your diary of what you ate. They try to eliminate food. That's one process. You could do a food sensitivity test and find out how that shows up and eliminate those. There's so many things out there, but there's something going on with us in our population wise that we're starting to show up with all these types of like weight increase, water retention, irritable bowel. There's something going on, and it's
Yeah,
always linked to inflammation. And what's now the next step is what's creating inflammation? Where is it at? So that's
right.
the mystery. And the thing with that is that's why this future is so promising for us, because now we have like, this platform where we can talk about it. And then through this platform, you may have a reader or a listener say, hey, that's interesting. And they do their own research and they follow a path that we follow them. And then, it daisy changes, somebody else following that person, and just continue on where now we're solving issues as a group, not as like one institute that capitalizes, patents it. I'm going to steal this formula. I'm gonna sell it as a
Yeah,
drug, and then next thing you know it, I'm gonna blow it up, and then here we go, right? So that's
yeah,
what's fun about this world now. Now it's back in the patient's hand, where I love educating people and say, hey, you know, research yourself. Don't just trust me. Don't trust this doctor. Trust, information out there that's provided out there. So that's what's fun
yeah.
about this times.
I know. I love that too, and I get really motivated when a client comes back to me and says, "Hey, I did what you said. It felt good. What else?" Or they start doing research on their own, or they are seeking out other wisdom or advice from somewhere else, or they're listening to this podcast and they're like, "I never thought of that. I'm going to start looking into that." Like, this is why I do this. Like, this is all for free. Like what we're doing right now. Like, you know what I mean? This is
Yeah,
just
yeah, yeah.
it's fun. And also, like I said at the beginning, this information is really stretching me mentally because it's something out of scope that I didn't even think about. So really excited that we're talking about this. Now, you already mentioned cancer and pregnancy. Obviously, you stay away from that because at this point, we don't know if it's a contraindication. But what about Canada? So do you know if Regen is going to be arriving here in Canada, or you're in the works with it?
Yeah, that's a good question. That's a big question.
Yeah.
I will look into that. That's a big hurdle.
Mhm.
I'm hearing two different things, and before I say it, I want to make sure I get my facts correct. But I
Okay.
do know that you know how that goes. You know, you've got the
Yes.
FDA, and there's such a control on our side, your side, and you know, I mean, the question is that I would love to get more involved with the Canadian route. We'll see in the future. So
Yes.
the future is open. So we'll see it. So let's talk about this in a couple months. How about that?
Yes. And then once you know, I will tell the rest or have you back on the show to denounce it.
Awesome.
So, yeah. Okay, what else did I want to ask you? Now, you have used this product on some of your athletes. And what was the and you talked about in your book on what typically would take for the athlete to recover from a certain injury versus the time it actually took with Regen. And do you want to talk a little bit about that? I mean, it doesn't have to be exact numbers, but just, on
Yeah.
top of your head. Yeah.
So when you look at athletes, right? Let's go in all to the top, right? With the professional athletes in the NFL. Now, the problem with the NFL world, these guys want to recover fast, but they want to stay on the field. NFL contracts kind of unique versus like NBA or other kind of like sports because this is the one sport where your contract's not guaranteed. Meaning that let's say you in the NBA or some other league, like baseball, MLB, you sign $100 million contract. Well, you're going to get the $100 million for that period of time. I mean, there's no clause saying if you're hurt, none of that, right? Whereas in NFL, you have it can say $100,000 or $100 million, but you have to have these performance. It's based on performance. So you're healthy this year, you make the playoffs, you do this, you do that. You can have that whole $100 million. So it behooves these athletes to stay on the field, right? You want to keep playing because you get paid per game and all that stuff, depending on how your contract's set up. So when it comes to recovery, these athletes, sometimes they just stay on the field. Even when they're injured, they're pushing themselves, they're pushing themselves. So when it comes to recovery, it's hard to manage that because they're always on the field. So you want to quickly get them back. So when you downgrade that from maybe like not so much a professional athlete, but a normal person with the same injury, now you've got a better chance. But typically when you see these athletes that have gone into retirement mode and they're in their like plus 35, 40s, well, now you have that recovery time that expands longer.
Mhm.
So just think about like an ankle injury that when you're younger, it took like a week and a half or 2 weeks. Say, hey, I can get back out there. Now it's taking 4 weeks and 6 weeks. So when you
Wow.
see that time expansion longer and longer because you don't have those cells or that signals that tell your tissue to regenerate, to turn on, to fix that tissue. So what you need is something to speed it up. So you take that span that, let's say for me, if I sprain my ankle, it takes me 12 weeks to recover because of my age. Well, I need to speed it up. So I have to introduce it to a high signal device, which is Regen, and I apply that. It speeds up the healing process faster. So I can cut my time in half based on just general science of what's going on here.
Yeah. That's incredible. Like, I just want that to speed up my recovery after exercise.
Yes.
Yeah.
If we, like, I remember one person said, hey, do you sell that in a bath form? I said, bath form, that's interesting. How cool
Yes.
would that be, right?
Yes. Put it with the Epsom salt or something, like it absorb my skin.
That's a great idea. Listen, wait a minute. I
Yes.
think we just developed a new line. Like a
Yes.
bubble bath, and then you put it. How great is that? Epsom salt,
Yes.
regen, and then some candles and zen out, and you could do so
Yes.
many. Not it's just physical recovery. Then you got the mental recovery, and then
Mhm.
you're having a whole body recovery. You come
Yes.
out of there like a superhero.
I could see you with like having a gift basket, like, with all these things inside it.
Let me tell Janelle, you just planted a seed behind us. How come it's not done yet? Let me see if you
Yeah,
can
you
just.
have to do that. There's is it Dr. Scholl's or I don't know. No, not Dr. Scholl's. It's a type of bath a liquid bath, but it has Epsom salt in it. So you could probably do it in liquid form, instead of doing the actual salt scoops. Like yeah.
Yeah, like a couple
Yes.
drops, and then all of this is basically signalers, and then you get the transdermal, and then the heat of the water helps kind of penetrate through deeper, and it's a whole body experience. Thank you very
Ooh.
much.
Or you can even get like, the, body aromatherapy oils, like, you just,
Yes,
like, put a little bit on there, it just
good.
yes. Oh, yeah, yeah.
I'm gonna have to call that. I'm gonna call that the Janelle protocol. Okay,
The Chanel protocol, please. I mean, I don't need any of the rights to it, but if you could throw my name in there somehow, like, that would be cool.
that is an awesome one. I started thinking about this. Why can't we do that? Let me think about that one. That was
Yeah.
interesting.
I
I
could
like
see
that
you
one.
call it gel, but like Jelle. It's a Janelle, gel because you're gelling no, I don't know. That sounds weird.
Wait a minute, wait a minute, wait a minute.
We got
Gel
something.
protocol,
Gel
jelly protocol.
protocol,
I
jelly
like it.
protocol,
This is
gel.
what brainstorming is all about. This is how it happens. Like here, he's sitting around, all of a sudden he goes, "Wait a minute, why can't we do that?"
Yeah, that's right. That's right. Oh, I love it. Oh my God. I swear, if we spend another couple hours, we're gonna, cure world hunger or something together.
Hey, I think we're related because I was gonna say the same thing right there, and I said, "Wait a minute."
Shut the front door.
I was thinking, we're gonna cure. All of a sudden, it came out of your mouth. Goes, it's so funny.
Oh, we're synced, man. Oh
We're
my
gonna check
God.
our DNAs. There's a link between us.
There's a link. Well, where were you born in Malaysia, by the way?
Okay, so right outside of Singapore, if you go Singapore north, there's a city called Johor Bahru. It's that little southern city of Malaysia.
Johor. That rings a bell. Do they have a lot of islands and water by any chance?
Well, you had to go over the island. I mean, Singapore's
Yeah,
an island, and you go over the
yeah.
bridge and into Malaysia. It's right there. It's like at the very bottom portion of the peninsula there of Malaysia.
Okay. I think I had some buddies sailing around that area, but I was in Kuala Lumpur for a little bit.
Beautiful,
So
right?
yeah, it's
Hey,
gorgeous.
isn't that funny about that whole area? It's not alive until nighttime. When it's cool, and it
Yes.
turns on. The whole place is like daytime at night.
Yeah, it's incredible. But I was also backpacking and I was on my own, so I had to be a little careful. But it's a funny story. I'll tell you one day. But this person that I met years ago out of the blue walked into the same bar as me. So that was like the only time I got to do the nightlife because I had someone there with me. But Malaysia is wild, man. Like there's like five different cultures in the same city and everyone's respecting each other. You know what I mean?
Yeah.
It's so neat. You could just be you. It didn't matter if you were showing a shoulder or an ankle or and someone else was covering up fully. Like everyone just had their own beliefs and they all lived amongst each other. It's so
Oh,
neat.
that's good observation. You know what's interesting about that whole area, right? From all the way from like, Malaysia, go north to Thailand, keep going north to Vietnam. That whole area right
Mhm.
there. What a interesting world that is right there.
Beautiful. Thailand's one of my favorite places on this planet. Like, it's amazing. Yeah.
Have you gone to the Philippines?
No, that is on my list. Have you been there?
Oh yeah. It's not just that. Of course, we all know about Manila, the big city, but
Yeah.
there are 10 million islands. I don't know how many islands are, but there's islands upon islands. You can get lost just looking at all these islands. But
Wow.
you can just, if you want to discover, you just got to watch out. There's some parts down there are a little bit, tough. But
Mm,
other than that, I mean, just that whole Indonesia, all that area, it's
yeah.
just, I mean, I wish we had more time on this earth because then it would be occupied over there. But
Well, I don't know. With all the creations that you're making, then we might live for. I tell
hey,
everyone I'm gonna live till like 120. So I'm gonna do my research, would help me with pain management and
hey, you're gonna have a podcast 2095. We're here
yes,
together.
yes, 25. I'm still doing this. What is that? How many years is that? I'm bad at math. That's a
It's
long
like
time.
70 years from now.
7 years
But
later.
but you know how like technology is advancing so fast for this AI and all this.
Mhm.
You can imagine what's going to happen. Robots, it might be just like that movie Terminator. I don't know where it's going to turn out, but I hope to be on the right side of everything. So I'm like, I don't feel guilty. I'm like, hey, I didn't really
Yeah,
shouldn't do all these bad things.
I'm gonna be like 120 years old with like Tomb Raider arms massaging people. It's gonna be perfect.
And traveling. Don't forget traveling too, right?
Oh,
Get
yes,
back out
yes.
there.
Yes, of course. Um, yeah, okay, we covered like the majority of my questions. I think the last one I had is that you had two different types of the creams. You have a two-part system. One is called Alpha, which is the morning one, and Omega for evening. Can you tell me the differentiation between the two and if they have different purposes?
Yeah, so the kit consists of those two bottles, Alpha and Omega. And again, Alpha is applied in the morning. Now, Alpha has a thermogenic effect, so it gives you that heat sensation. So as you get, that kind of penetrates through the skin, it lasts a long time. It lasts up to 36 hours, that heat. So every time you exercise or you feel that warmth, that's the regen kicking in. So you have to neutralize that with Omega. Omega is applied at nighttime, so then you're able to sleep without that heat during the night. So those two will yield as much as the injectable from a stem cell therapy.
Okay, and do you need both of them in a day to have the effects? Like, do they work together? What I'm trying to say, like they collaborate together, or are
Oh no,
they? Yeah.
It can be separate, but you want to use
Okay.
those two together because those two will do the 30-day type, so 30-day protocol that yields.
Okay.
So you want to match it up just as much as injectable. So those 30
Right.
days will yield that injectable quantity. So that's why that's used in the morning and evening. So they both have the mesenchymal stem cells, EB, the signalers, and
Yeah.
they both have the penetration. One just has the heat, which is the alpha, and the one has the cooling, which is the omega. So it allows you to
Right.
sleep at night.
Yes. I could see you making the bath gel for omega with Epsom salt.
You know what? That
Hmm.
you got me thinking about all kinds of things. You're talking about like even in those those what do you call it? That vaporizing that
Yes.
what's that smelling thing? What's it?
Aromatherapy machine.
Aromatherapy. I'm
Oh,
thinking about that. Well, how interesting because
yes.
another way of getting stem cells through our body is not just topical. There's the IV,
Hmm.
intravenously, or you can do it intermuscular, into joint. There's also you can do a nasal spray.
That's
There's one
perfect.
you got so, but then you work into go, well, how about aromatherapy into that vaporizing of the fluid? Let me do some research because I don't know what's happened in the mechanism. It may maybe vaporizing turns those molecules and breaks up those capillaries. I've got to look into that one, but that's
Yes.
that's uh
But like, cause they have the Vicks machine. So there's different models, of course, and brands, and they shoot out a lot of humidity. So it's like a heavy dose. And then the aromatherapy containers that are just for like, make the room smell nice. It's a little bit more delicate, not as much. So you have to look at the square footage of the space too, right? And
Mhm.
is the machine intended to be blowing on someone's face at night? Or is it just to make the room smell nicer? So that's one thing you'd have to look at. But, why not just do the old school way where you have the, what do you call it? Just like a
Yeah.
pot with boiling water, and then you put a couple drops and put a towel over your head. You know what I
Oh, I
mean?
love that. I love that. I
Yeah.
still did do that. And when I have when I have sinuses, that's what I do. I just go ahead and get that boiling water, put it over there, and I just
Yes.
try to get the humidity in there, and it breaks up all that mucus and it drains out.
The nasal rinse. The
Oh, the neti pot.
neti pots.
Oh my
Yes.
God.
Oh my God. So, because here in Quebec, medical system is rough. It's rough to get a doctor. Some people are still waiting, and they've been living here for like 6 years. And we were fortunate that we got one after 3 years. But like, it's really made me think of preventative things now differently with my kids instead of being like, "Oh, I'll just go to the doctor if it gets really bad and they'll take care of it." Especially with the issues with chronically taking antibiotics, right? Because that mess up our microbiomes and all that, and then that can lead to more inflammatory issues, right? So now I'm trying to do preventative, and it's like the kids. I mean, my kid is 8, 5, and one's almost 2, right? And I I do the neti pot thing with them. They hate it, but I'm like, well, do you want to get really sick? Or do you want to be like, eh? You know what? So, and then I get them excited about it because they can see all the boogers come out and stuff, right? And they love that part. I'm like, look at that big booger, like, whoa, like monster booger. So I try to get them excited about it. But if they had something like that for kids, like almost like a homeopathic slash, I don't know, there might be some legalities around that, but for sure with adults, that'd be super effective to get rid of all that sinus pain, you know?
Oh yeah, yeah. You know
Mm.
what I do here is I'm in Florida, so I have the luxury of the Gulf of Mexico and the salt water.
Oh,
I'll jump in the water and then I just invert my head and I just let the fluid go right into those nasal cavities. And I mean, it stings you, but when you come back out, you're flushing yourself out. It just exhausts off that whole thing.
yes.
You're looking at it and goes, holy cow, where's all this stuff coming from? But it's just caught in there. You just got to get it out.
You gotta get it out. Oh, that's so nice. I wish I had that. We have fresh water, but we're in Canada, so it could be really cold at certain times of the year. So, yeah, we don't always jump in, and then some of the lakes and rivers are not the cleanest.
No,
So,
no, no, no.
unless you're up like in Banff, you have the Bow River. It's like crystal blue. It's stunning. Comes straight from the mountains, but it is very cold. Yeah, that is a
Hear
cold
about that.
plunge. Yeah, that's a nice
I hear,
plunge.
yeah, I hear that people talk about the beautiful, like the pristine water. Don't go in that thing. You will deserve that little shortness of like breath. I mean,
Oh,
so
yeah. Well, yeah, in the mountains for sure. And like the under the rip, like it could really pull you underneath too. So you got to be careful.
really,
Yeah. Yeah.
That doesn't sound fun now. I think from a postcard, I love the view.
Yes, yes. Just enjoy the view. Maybe dunk your toe in and that's about it. So, Tommy, is there anything else that you like to add that maybe I didn't ask you or you feel like our listeners should know about?
Um, I guess maybe the biggest thing that I just want to express that the reason why this whole industry that people are trying to get involved with or understand stem cell therapy, it's kind of confusing out there. So when I walked into this world, I was just meaning to help my athletes, and then when I helped my athletes, it became almost like a necessity to help my patients with this. So then it just translated easy that way. And then, but the difficulty is explaining. And when I try to explain it, it took a long process, and I'm repeating myself. And that's why I wrote the book. I wrote the book to explain what's going on and then how the future is going to evolve the topical. So I guess the biggest thing is that, when you guys go out there and hear the word stem cell and trying to figure out, hey, do I do it here? Do I go to Mexico? I mean, do research. Don't just look at my information in my book. Go into more deeper, ask AI, ask Google, look at these podcasts, and then try to get your own idea and start with that process. Because when you see these clinics that say stem cell therapy, we can heal you, and it stops right there, you have to ask yourself, well, what is it doing? What are you injecting to me? What is going on? Now, where are these donor tissues? Because our tissue comes from a donor of the umbilical cord during C-section. And the big thing with that is that we have the traceability. We have like a questionnaire, serology, blood tests, everything you can think of to make sure that this is the best quality of tissue that you want into your body. So I think the biggest thing that I want to relate to you guys is try to get your information out there. I mean, find information you guys can get out through this pathway of podcast or AI, or just, reaching out to me and just ask me questions.
Yeah, absolutely. And just so you guys, a little refresher, the name of his book, and I'll put it in my show notes too, is The Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy. And the thing is that, like, the thing with science and medicine is that it's moving. Like, every day there's something new, there's new research. But what I think, even though a book like this may not be evergreen in a sense where, because things change all the time, but at least it will give you what you need to know about the basics on stem cell. And I'm not saying basics because it's simple. It's not. Like, there's a lot of information, but you break it down so you have the basis of where to start and understand what stem cell research currently is all about and what had the benefits it could do for you and the contraindications, right? So
Yeah.
though that's the important part. And like you said, it's constantly changing. And with ChatGPT now, it's insane. But I have to say, though, that it's not always accurate because it's pulling up information from other websites. So if they're not accurate, then ChatGPT will be inaccurate. You know what I mean?
Yeah. Oh, yeah. That's the big thing, is that just always cross-reference everything. Don't just check on one source and stay with that source. Keep going out there and doing your research and make sure
Yes.
that source is correct with another source.
Yes, that's right. That's right. There was one other thing. Oh, yeah. Where can we get your book? Is it on Amazon? Like,
It's on Amazon. Amazon,
okay.
you just put on the search bar Dr. Rhee, Rhe, and medicine, it should pop up.
Perfect. Okay. I think we covered I'm impressed. We did really good for time because I had so many questions for you.
Oh, okay. Well, I loved it. It was
Yeah.
so much fun. This is great. I love conversations.
Yeah, me too. And you're a real people person, like, and this is what's really interesting is that when I was listening to your information and it is so intelligent, well thought out, like scientific, I was like, I hope this interview isn't a bore. Because sometimes they talk so generic and they're so stoic, and I'm like, okay, what just happened? But you are so fluid and easy to speak to, and you're so personable, and I appreciate that. So thank you for our entertainment today as well.
Hey guys, I just want to tell you that I didn't pay her for saying that.
No, oh yeah. Do some people say you're a bore? Like, he's not
No,
the
no, no,
sweetest
no.
guys.
This is what I do know. I like conversations, and you make it so easy to have a conversation. And I don't know why, but it's like we're related or something, because it's like, I'm thinking like
Yes.
right down this pathway. All of a sudden, you're going that pathway. Goes, wow, so cool. So that's why it's easy. That's why I
That's
guess it
so
went
cool.
so smooth, this processor.
Exactly. I love that. And well, we'll chat more about that because I think I know what's going on here. It's like they're telepathic or something. Well, if I'm ever down in Florida, in Tampa Bay, I will come and see you. So,
Awesome. Yeah. Bring the family.
yes,
Well, we'll get in the salt water and we'll get in the real negative
yes,
treatment.
we'll do the neti pot. Everyone's like, "What the heck are those people doing?"
Why be upside down in the salt water? How come they don't appreciate the sun? They're always digging for something down there. And they keep coming up and blowing their nose.
They're like, "Why aren't they wearing those goggle mask things? What do you call those, like, snorkel gear? Like,
Yeah, yeah.
put a snorkel gear on, you idiots." Okay, well, I appreciate you so much, Dr. Tommy Rhee, everyone. Thank you, thank you, thank you. What a privilege.
All right. Thank you very much. And I enjoy this.
5 minutes later.
So, Tommy, can you tell me a bit more your insight on the cortisol shots that people are getting done, like if they have injury or a lot of pain into their joints? Like, what is going with that? Like, what do you agree with it? Or is this something that you see often in your practice? Do you actually recommend it?
Yeah, so cortisone shot is an anti-inflammatory protocol. So you'll hear people that will have aches in their joints from inflammation, excess inflammation, and it's giving you a restricted kind of movement. So they'll have like, I have pain when I walk, and when you do an X-ray or a test, and you see like excess fluid. So, all right, so you have the signs of osteoarthritis, which is inflammation of the joint. So then they'll say, all right, we'll do an injection of cortisol and it will reduce the swelling. Well, the problem with that is that not only does it reduce inflammatory, it reduces the tissue around that, including the cartilage. So
Mhm.
that's why they only allow so many of those injections per year, because they know in excess it would destroy the joint, the cartilage around the joint, where you start getting like bone on bone appearance down the line. So when you hear about like cortisone, especially like in the old days in the 70s and 80s, that was like a standard process of therapy for a lot of people in the athletic world. Hey, take a shot of cortisone. Well, as these guys retire and they go into like, their recovery world of just retirement, well, now they're always, you hear stories like, oh, hip replacement, hip replacement. Well, it's because they have excess of those cortisone injections. That's the
Yeah.
problem. It chews down the cartilage. So, when I hear about that, I say, well, let's do something else before you start walking down that world. Why don't you do other things like dynamic stretches with no low, low weight bearing. Do that oncotic pressure, positive negative gradient, to push that fluid out. There are things you can do your body that it takes time, but at least you avoid that long, progressive, deteriorating tissue that you might be susceptible to, like a joint replacement. So, when I hear like a joint inflammation, think about like dynamic stretches, no load things, like just easy, simple movement back and forth, and then get that fluid to push out, because that positive, negative gradient of pressure in that joint will flush that fluid out. It takes time, but you can do it yourself.
So by flushing out the fluid, you're recommending just like movement of the joint. So whether that's like, let's say if it's in my shoulders, just like doing this, ow, sorry, not hurting yourself, doing circular motion, or like, are you talking about actually like exercise, like using the bands and stuff like that?
Yeah, yeah, no load. Just do the same motion with no load, because you just want the
Okay.
joint to move. That's all you want. You don't want load on the joint. You just want to just move the joint. And then with that movement, you start getting that excess fluid to flush out. It goes
Right.
glycolically out.
Perfect. And one thing too is I tell my clients is that look at your posture, because I find if you the reason what has caused us in the first place a lot of time is our posture or how we're standing or lack of strength in the joints. But from what I hear you saying is that make sure we pump out that excess fluid that's in the joints so it could start to heal. Now, well, just flipping this in a different direction here, but did you find that using the Regen cream has helped significantly those clients where you haven't had to suggest the cortisone shot?
It's big.
Okay.
Remember,
Yeah.
because remember, when you're looking at those inflammatory joints, you're looking at typically like it's not so much an injury, it's overuse, right? So when you start
Mhm.
looking at tissue that's degrading, you're getting that inflammatory world because some of the tissue is getting compromised because of that joint space or the loss of tissue. You have to grow that tissue back as fast as possible, and that's with regen. So you're trying to do two components. One is the anti-inflammatory protocol, and then the other one is regenerating this tissue, and that's what regen has, those two
Yeah.
components to help out.
That's perfect. So So what I suggest to everyone, I mean, eventually I'll come to Canada, but for now, and all my listeners from the United States, look at the Regen. And then where they could find it would be on your website where professionals, health professionals can get
Yep.
themselves. And now, is it like a prescription in the US or is it something you have to, or you can go buy yourself?
Yeah, it's almost like a prescription. You have to go to your provider. So just
Okay,
contact me. Just go to my website, which is RheeGen.com. And then you can learn about what Regen is and how it's maintained and how it works. But really, what's really important is you take that information and give it to your provider, and then the provider will reach out to me, and then I can ship it to the provider, and then they can dispense it out to the patient. So
perfect.
because it's got ingredients that exceeds the actual like what they call the over the counter type of like levels, you have to go to a professional level, and then they can dispense it out to their patient.
Okay, this is so cool. Like, OMG, I can't wait until this is in Canada because I am trying to encourage my clients to stay away from the cortisone shot, but they're in so much pain or they're getting no sleep at night that they feel like that is the only solution for them. And but meanwhile, they're not doing the range of motion. They're just expecting their team to fix them without them doing their homework, right? So not all of them are like that. Don't get me wrong. Some of them are doing everything possible and it's still not working fast enough, especially perimenopause or menopause women with frozen shoulder. That's another big one is, so I'm curious if you found that this has helped with those situations too. And just so my listeners know, frozen shoulder is like where literally your shoulder blade is like locked and you could hardly lift your arm up. I've seen it at different degrees of how the severity, but have you found that to be helpful by any chance?
You know, so frozen shoulder is that they call it the capsule around the joint that's kind of like locked in the adhesive capsulitis, right? So it's that
Yeah.
GH joint, the glenohumeral joint. So the big thing with that is that they're trying to protect it. They don't want to go into harm's way. Well, in that world, you have to go into harm's way. You have to break up that adhesion. You have to get aggressive. And you know what you have to do, right? You take that patient and you have to really get excessively into that axillary area, the armpit, and hold
Hmm.
down the humeral head and then really do movement. I mean, they don't like it, but you have to do it because the secondary thing is, of course, surgical or implants or something that's going to give them in a bad scenario. So regen will be the secondary. The primary will be working with you to break up that tissue to get that kind of like that excess scar tissue. But then regen is used to help heal the tissue and lay it down correctly as you're doing the exercise and make it like lay down correctly.
Yeah. No, it's very painful, the treatments that I have to do, and it's not so much my treatments are any different, it's just that they're already in a lot of pain to begin with, and then you apply the pressure too, but, absolutely. Okay, well, this was awesome, thank you.
Ah,
I said, "Tell ya, I'm gonna have more questions for you every time."
that's awesome, awesome, awesome. I love it.
Anything else you'd like to add about the cortisone shots?
No, no, no. I think
Okay.
the best thing to do is have someone like you just advise them correctly.
Yeah, and like you.